Good afternoon. My name is Nicole Gallo, and I thank you for joining us today for this co-presentation between Rittenhouse and FEDLINK. We're going to talk about some tools and services that are available from Rittenhouse to support you. As I said, I'm Nicole Gallo. I am the Executive Director of Sales and Marketing for Rittenhouse Book Distributors. There's my contact information. I am typically based in our King of Prussia office. Right now, probably like everybody else, I am working remotely from my home out in the suburbs of Philadelphia. I'm doing well, as I hope you all are staying safe and healthy during this time as well. A few housekeeping issues as we get started here. We will be taping this session and it will be made available on our YouTube page. I will be sharing the link with Robin so that you will be able to get to this, or if someone hasn't been able to join today or joins late, I think we have a few more people coming on here, you'll be able to access the presentation in its entirety. Audio is muted for participants. So you can participate though. We have a Q&A on your toolbar. So if you look at your toolbar, there's a little arrow there with questions. At any time, you can feel free to type a question. I will reserve time at the end of the webinar to answer questions. And I am happy to stay on as long as we need. There are some handouts also attached to this webinar. So a lot of the services and things that I'm going to cover are in the handout section. So you can grab them and download them right from the webinar, and you don't have to furiously take notes or try to remember what I'm talking about. Okay, so today we're going to spend a few minutes reviewing how to access a lot of the free services and tools that Rittenhouse makes available for our FEDLINK partners. We will be covering print and ebook collection development, as our contract covers both. We are going to take a quick look at some healthcare trends. We're going to provide an overview of the Rittenhouse book distributors for print and the R2 digital library for ebooks. Some of the tools and services that we have there. We're going to talk about access and discoverability just briefly, and I will, of course, give you a sneak peek and discuss some of our deep discount offers that we have going on at Rittenhouse. Okay, so I'm going to launch a poll because I'm interested here to see what you all think with regards to what some of your biggest challenges are. So the poll is open, so if you wouldn't mind just answering the poll. If you could on the screen. I'll wait a few more minutes, a few more seconds, really. Okay, so it looks like we're running a pretty close tie between staffing, time for collection management, and also knowing what to purchase. So I'm going to go ahead and close that poll. It really is interesting because we're going to cover a lot of different ways that we can address how you can get more done with fewer people. We're here to help. Time for collection development, we know that that's at a minimal. There's a lot going on, especially if you're in a hospital setting right now. And knowing what to purchase is always a challenge. So we will definitely take a look at some of the solutions that we have with regards to addressing those. So as I said, we are here to help. So whether you're collecting in print or digital or both, we have what your library needs to save you time and money. So the tools and services and some of the outreach, how we work with FEDLINK, we make it pretty easy to get a quote and also savings opportunities. So we definitely can work with you no matter what your needs are. Okay, so we're going to take a quick minute here and talk about some government healthcare trends. You all probably are well aware of these things, but I was doing some research in preparation for today's presentation, and I didn't realize that the VA is the nation's premier graduate medical education partner. So the VAs are affiliated with almost every major medical school in the nation. You've been teaching and training health professionals for 70 years. And the VA really is one of the best ways that residents get exposure to integrated healthcare in the US. So you have seamless electronic health records and unique learning opportunities. So a lot of what Rittenhouse does to this end is ensure that you can access this information that you need for these residents. So one of the things too that I realized as I was doing this research is that changing priorities of patients and the marketplace are forcing medical schools and the VA to consider new ways of practicing medicine. And I think now with COVID-19 and everything that's going on, that is more apparent than ever that we need to be able to have remote access and make sure that we are up to date with the latest and greatest with regards to healthcare and medical information. So we're your partner for ensuring that timely and integrated access to information. Okay, so Rittenhouse.com. For some of you, you are very familiar with our web services. This will be review. Hopefully you'll be able to get a few new things out of this. If you're not familiar, we are happy to partner with you after this webinar to give you some more information. But Rittenhouse.com is where you find our print books. And this is what the homepage looks like. When you go to Rittenhouse.com, first thing you really should do is log in. So up in the right-hand corner, I have it circled there. You want to hit that login button. Your username and password. Your username is typically going to be your Rittenhouse 6-digit account number, and then the password that you've selected. If you don't have access to this, we're happy to get you set up and logged in. But being logged into Rittenhouse.com really is where you will get the most information, and it is customized for your specific institution. So a lot of our services are customized. So if you use that username and password, you're going to find access to that much more easily. So once you log in, you will be redirected from the homepage to our library services page. So on the library services page, you can manage your account, you can add users. A couple of interesting things, you can look at order history. You can also make claims or look at our returns policy. This is also where you access all of the services that I'm going to be talking about today. First and foremost, any of our promotions or special offers will always be available right there once you have logged in. The other great thing about using your login and having access to Rittenhouse.com is that we customize the information on the screen so you will automatically see your discount. So you can see here, this is a book detail page for current diagnosis and treatment and surgery. You can see all of the bibliographic information. You can expand that and read about the title. You can see if it's a duty core title or a former Brandon Hill title. But most importantly, you can see your discount on that title. So standard discount for the government is 18%. We do offer an extra 1% for online ordering. So you can see here that you have this 19% discount on this title and what your discount price is. You can also see our quantity on hand, which I know if you're looking for something, you know, this is a 2020 edition, it's new, it's hot, you want to make sure we have it in stock when you add it to that shopping cart. So if we don't have it in stock and the quantity on hand says 0, but it is available for sale, most of our publishers we work with, you can put that book on order and we receive it within usually 1 business week, sometimes as fast as 2 days. So if we don't have the quantity on hand, we can definitely get it if we make it available for sale. You can tell if it's available for sale. I have circled over here on the right if it says add to cart. You can always add that to your shopping cart. Whether it's a forthcoming title, so it hasn't yet published, you can put it on order, or if we're out of stock, you can certainly do that, and if it's in stock. If it is not available for sale, it will let you know that, and we will link you out to either a new edition or a previous edition that is available for sale. So there's a lot of information right here on this page that you can use with your collection development when you're looking to add print resources to your libraries. So this is a quick look at the shopping cart on Rittenhouse.com. So I've curated a cart here of 4 titles. You can see there's a lot of information here within the shopping cart. And from here, you can continue shopping, you can change your quantities. A couple of key things: if you would like fund and location codes, you can add them at the order level or at the item level. You do have the ability to do that right here from your shopping cart. You can see your discounted price. Down at the bottom, you can see where you can enter a promotion code. And right now we have Rites of Spring going on. So once you enter that code, now we've applied the promotion, and you can see that discount has jumped from 18 to 22 plus your extra 1. So you're going to have the ability to control that right here from the shopping cart and take a look at your discount and make sure that if we're running a promotion that you take advantage of that. Now, a quick word here. I know that you now are required to have a quote when you're making a FEDLINK purchase. You can export and use this cart for your quote. So when you hit that ILS export button, you can export it into Excel. You can just take a screenshot, but all of the pricing information is here along with the ISBN, your discount information, your total cost. So you can use this as a quote for making a FEDLINK purchase. So if you need an official quote from customer service, you can just direct them to your shopping cart and they'll be able to create a quote for you. But oftentimes we're just taking a screenshot of this page and you can use that for your purchase. So this is true for Rittenhouse.com for your print orders, as well as for R2Library.com for your ebook orders. So I know the process has recently changed, and we are working within your guidelines to make sure that your FEDLINK funds are being appropriated as required. So this screen right here, once you have it into the shopping cart, is a great way to easily obtain that information. Okay, there I've circled where you can export the MARC record as well. You can export it as a text file, you can export the MARC file. All you have to do is hit that button. So if you need this information to feed into any of your systems or to create records, you have access to do that right here from the shopping cart. Okay, so a few words on health occupations before I go into a few more of our products and services. To grow more than 14% in 10 years, which is much faster than the average for all other occupations. So this equals about 1.9 million new jobs, really projected to add more jobs than any other occupational groups. So every time we look at this stat from the BLS, it seems to grow. Healthcare is just exploding, and typically when we see a downturn in the economy, we see an upturn in enrollments for healthcare. So I anticipate that this will continue to happen. And of course, as people are facing disease or epidemics, the need for healthcare workers is even greater. And the same holds true for medical school trends. Right now there's a physician deficit, and it is projected to grow to about 52,000 by 2025. So that's just in 5 years from now. There are a lot of ambitious goals out there for expanding the number of medical school graduates in the US by 25% by the year 2030. So what this means is that you'll have increased enrollments at medical schools, new medical schools being accredited, as well as hopefully seeing more residency positions opening up, which will directly affect your needs at your institution. So there is a lot going on right now with medical school enrollments as well. And then, of course, nursing trends. So the same thing is happening in medicine is happening in nursing. There's a shortage, and this workforce is expected to grow to almost 3 million, from almost 3 million to 3.4 million by 2026. So that's a 15% increase in a pretty short time. There is a shortage probably of about 200,000 nurses each year through 2026. So we need more nurses to fill these positions. So health professions, medicine, nursing, huge needs there. We anticipate growth in the numbers within each of those areas of occupation. So, we're in the job of providing these groups with access to information, whether they are in their education phase all the way up through practicing. And we're well positioned to be that hub of information for all of these practitioners and students as they're coming into practice. So I like to keep my eye on this because it does change, and it seems to be that the shortages are becoming greater and the need is becoming greater. So it affects all of us. Okay, so we can work with you to keep your library up to date. So we at Rittenhouse have a lot of services that we offer, and they all are free, which is great news for everybody. So I have a list of services here. You may have heard of some of them. Maybe some of them you have not. We have something called a core collection update. We do instant quotes. We can assist with new title collections. Duty core titles we have available for free on our websites. I showed you how to access MARC. And we also give extra discounts for ordering online. So there are a lot of ways that we work with you. Core collection update. This is a free collection development tool that is designed for a library of any size. And essentially what we do is we can work with you to save time. We know that you are short-staffed, and we know that you don't have a lot of time for collection management, especially with the demands of research today. So we will assist in updating your collection. So we will work to update your existing print collections. We provide new edition information. We let you know if an ebook is available, and we also provide pricing. So essentially what will happen here is we'll take your shelf list of your collection, and we can research it for you, let you know what's available in a new edition, and or if that edition is available in print, and provide that back to you so you can see what it would take to get your collection up to date. So this has been a very popular service. All we need, really the most important bit of metadata is ISBN, if you can export that from your collection, from your ILS, and then we'll get to work for you. So we have a library services team that is hard at work doing research on these updates. And it is really just a great way to get a good idea of where you are with your collection development. A quick word, if you are looking to go from print to electronic, this is one of the best tools that we have to assist with that, because we can look at your collection in print, let you know what is available digitally, and you can plan as you're migrating from print to electronic to add the electronic resources to your collection. Okay, so if you're interested in that core collection update, all you need to do is get in touch with me or your Rittenhouse sales representative and get us your shelf list, and we'll get to work for you. Okay, so we have something called Express Checkout, and this is a big time saver. You can place orders on Rittenhouse.com. It's also available on r2library.com, where you can research or enter multiple ISBNs all at once. So you can put the ISBNs one-on-one, or you can just copy and paste and enter them as a bulk order. And from there, you can get your pricing and availability. So again, this is something you want to be logged in to the system for. When you're logged in, you can see along the left navigation is the Express Checkout button. From here, once you hit that, this screen will pop up where you can see you can enter an individual ISBN, or you can bulk load ISBNs. So when you bulk load ISBNs, that's what it looks like. You can just put in a list of ISBNs, and from there, it's going to give you all of your pricing information. It will let you know if the ISBN is no longer in print, that it's no longer in print, and you can go from there. So you can see there, you know, the ISBN. You can adjust the quantity to ship here. So maybe you want 2 or 3 copies of something, you can do that. Your list price, your discount price, etc. So from here, you could delete and curate an order. But you can also, at the bottom, you can see where you could add a new title, or you can just add that whole group to a shopping cart. So it really does save you time from entering all those individual ISBNs. Let's say we did a core collection update for you, and you're looking at that and you want to order a group of them. You can just copy and paste that right into that Express Checkout and add to your shopping cart. So Express Checkout really is handy. It was developed with feedback from librarians to assist with workflow. And again, it's one of those ways that we work with you, knowing that you have fewer people to do what needs to be done, and you don't often have time to get to things like this. So we have enabled it through Express Checkout. Okay, a little bit about collection development. We curate a list of new and noteworthy titles every month for libraries. So we look at what's coming out, what's forthcoming for medicine, nursing, and allied health. We make these titles available on our website, and you have the ability, again, to look at what's coming and add them directly to your shopping cart. You can use those lists and manipulate them as you need to. And we also push this out via an email. We call it our new and noteworthy titles e-newsletter. So you can visit Rittenhouse.com. Again, log in. You can see new and noteworthy titles. This is where you can access the lists. And you can see here we have March, April, and May up. You can print or export or email those lists right from the screen. But you can also sign up to have this list pushed out to you each month with a link that will take you right to the list. So again, we know how challenging it can be to keep up with all the different publishers in health sciences. And as an aggregator, we bring them all together in one place and let you know everything that's forthcoming and that looks like you might be interested in your library, and we make it easy for you to buy. So those new and noteworthy titles for libraries, a great way just to stay up to date and not have to worry about keeping up with all those emails coming into your inbox. We kind of distill it down to one place for you. Okay, so duties core titles. You may have seen a press release from us in the last day or so. The 2020 duties core titles has published. This is the list of core titles that is recommended for a medical library. And we partner with Dan Duty to make these available on Rittenhouse.com. So we license the DCT from Duties so that you can access it for free on our website. So you can see the reviews, you can see the star ratings, you can, there's a lot of tools that we make available from Duties right here on the website. So you can see a customized list of the Duties core titles, DCT titles, based on what you've purchased. And you can also look at last year's list here as well. So we keep up with the DCT titles. We do note them when you're looking at the product detail page, and we make it easy for you to access this rating service and review service for free. So we license that, both the DCT Essentials, and reviews from Duties Enterprises. And it's really just another way to ease collection development. So if you're new to health sciences, perhaps, or you aren't really sure where to start with the new editions from 2020, you can use the DCT as a core list to guide you in that effort. If you're interested in hearing more about this, we are hosting a webinar with Dan Duty next week just to talk about how we curate this for the hospital environment. So Thursday, May 7th at 2 o'clock, we're hosting a free webinar. More information to come on this, but certainly you can let us know if you didn't receive this invite. And we do encourage you to attend. Dan Duty will be on to talk about the 2020 list and its importance from a hospital focus, and Rittenhouse will be demoing how to use our tools and services. So DCT, timely right now as the list was just released, and I think this week. So this is coming up next week if you're interested. But I do recommend that you take advantage of the DCT information on Rittenhouse.com, and it saves you from having to subscribe to it directly. Okay, so don't forget, I mentioned it earlier, but all print orders placed on Rittenhouse.com receive an additional 1% discount. So when we took a look at that shopping cart, it was automatically included because you're online when you're placing that order, which is great for FEDLINK because that discount is already in the quote that you're seeking to have your order placed. And also, I wanted to mention here before I start talking about eBooks a little bit that we are more than health sciences. So our website has 3 million ISBNs. We have titles in medicine, nursing, allied health, but of course, all that scientific, technical, medical, and oftentimes consumer health, that other areas that you might be interested in, we have available on Rittenhouse.com. So, always throw an ISBN in and see if it comes up in our system. Okay, so I'm going to talk about eBooks here for a few minutes and talk a little bit about collection management solutions. I found an interesting survey out there that was done by Elsevier on librarians moving from print to electronic resources, and government customers were part of this survey. 72% there said they are shifting to the electronic library, which makes sense. 58% say they wanted to provide multiple user access to content. And many of those who surveyed echoed all of the same benefits that we're probably aware of. Easy to get remote access, reduced space requirements, ability to do searching and browsing, 24/7 availability, and an expanded range of topics and more current content. So eBooks really do fit a niche. So when asked why the libraries were shifting to the electronic library, overwhelmingly it was to meet users' needs. Interesting, about half said they want print and digital. We've heard it from almost everyone, space is an issue. Now, of course, with COVID-19, remote access has really taken the forefront here. And also, at times, ensuring that no matter where your physician or your student is 24/7, they're able to access the information that they need. So having an electronic library to support your physical library, really important. So our ebook website is the r2digitallibrary.com. This is where you access all of the ebooks that we have available. We curate our R2 collection pretty carefully. It's clinically oriented. You will find one of the most robust collections of ebooks in nursing and allied health. And our philosophy has been from day one that as an aggregator, we really believe that bringing together content from multiple publishers in one place will give your patron the best answer to their questions. So we bring that publisher's content to work together as a database. And so your database is curated by you, but when your users are accessing and searching and browsing, they search across all of the content for an answer to their question. So we're very clinically and topic oriented, and it is very user friendly. So if you haven't seen a demo, we host them weekly, and we do encourage you to take a look. If you are active on R2, hopefully I'll cover a few things that you were unaware of. So with the R2 Digital Library, we have two business models for ordering ebooks. We have firm ordering. You purchase those individual ebooks or collections, and you select only what is important for your collection. You pay once for perpetual access. So all of the ebooks are priced individually. You pay once, you have access to them for life of edition and into archive status. Out of print is archived on R2. So you always retain access. Your links always resolve. The National Library for the VA has made some purchases, and many of the individual institutions support that purchase with local collections. So you have the ability to do both here. And we will continue to work on the national level, but also you have the ability to augment on the local level based on those collection development needs. So a great way to support that is with patron-driven acquisition, where you are able to trial the content, open it up to support your purchase content, and there's no initial cost there. So your users get 3 full text accesses to that content, and there is no auto purchase. So it's really just a great way to gather evidence. It really is evidence-based collection management, and that is our PDA. So again, much like with Rittenhouse.com, R2library.com, we really encourage you to log in, and that's the best way to view your dashboard and see what is going on with your collection. This is where you can find information about our special offers and your account usage. So you can see your number of titles and how it's being used month to month. One of the things that we like to talk about with the R2 Digital Library is really our low cost per use. So the lower the cost per use, the better the value. So we provide usage analysis right on the platform. You have real-time access to usage. We are using counter reports. I hear by Friday we're going to have Counter 5.0 up and running, which is the latest version of Counter, which is the standard for counting ebook usage. All of those reports are available on R2. One thing I'll say here is that with R2, you'll always know if your ebooks are being accessed. We really want to be sure that your patrons are accessing and using what you have purchased. And you can easily see that information on r2library.com. And you can break it down. You can go as far as specific discipline, specialty. You can look at your cost per use by title. We give you a lot of different ways to conduct analysis of your collection. The great news is when you're setting up reports to be run, you can have those emailed to your inbox. So you're always going to know if your R2 digital library collection is being utilized. Okay, collection management solutions. Much like we do in print, we have special collections curated on the R2 digital library. DCT is one of those collections. So if you're looking at the R2 library, and I'll show you that in a second, we've curated these lists. Once you log in, you can certainly hit any of these links and see all of the titles. We have free eBooks, which I'll talk about in a moment. We have Health Admin Essentials, which is really popular in the government institutions. And we also have a lot of standards and guidelines in nursing. So, but these collections are curated and kept up to date. Residency Essentials has also been very popular in the medical hospital, teaching hospital setting. Okay, so here's a look at the screen. I have highlighted here special offers under collection management, but this is also along the left nav where you will see all of those special collections I just mentioned. And you have the ability to log in and take a look at those. Once you are logged into the r2library.com, it's very simple. We have shopping cart functionality. So at any time you can add a title to your collection, check in, check out, and have access, or add it to your patron-driven acquisition collection if you have started one, or start a patron-driven acquisition collection right here from the screen. I mentioned DCT. I wanted to point out the duties core titles. We have the icons, whether it's a DCT or the bullseye if it's a DCT essential. But you can see, in one click, you can look at all of the DCT titles or DCT essential titles on the platform. So it's really easy to drill down. And again, if you're just getting started, or perhaps you haven't, taken a look at R2 in the past, using DCT to start a PDA collection is a great way to start, because you know that they are reviewed titles that are recommended for your library. And if you curate a collection using the DCT filter, you know that they've all been recommended. So it's a great place to start. And we have them for medicine, nursing, and allied health. Okay, so PDA, I mentioned how easy it is to purchase and manage PDA from the platform. It provides that free access to the eBooks. It's mediated, so nothing is ever auto-purchased, which I know is important as a FEDLINK account. And you can add these eBooks to your PDA collection in one click. So just like when you purchase a title, when you add a title to your PDA collection, access is immediate. And you can also export and get the persistent URLs or the MARC for your collection and your PDA collection very easily from the platform. I'm going to show you that in just a second. One thing, I mentioned core collection update and keeping your collection up to date in print, and how we can review that, let you know what's available for R2. The R2 platform has auto-replenishment for PDA. Which if you're on R2 at all, I highly recommend that you set up a PDA wizard for auto replenishment. And I have a couple screenshots here, but along the left nav, you just have to hit that PDA wizard button once you have started a PDA, and then set your parameters. And essentially, you tell the platform what to add to your PDA automatically. So you can add new editions of your purchase content. You can add new editions of your PDA collection. You also have the ability to just add titles from any special collection or purchase area. So let's say you have a DCT collection, you have the ability to have any new titles to the duties core title list automatically added to your PDA. And again, it's not a purchase, it's adding it to your PDA. So you again will control when you want to purchase that based on usage. So auto replenishment is definitely, I think, the way to go. Earlier, 75% of you said you're concerned with time to look at collection management and not enough staff to manage it, which is universal in libraries these days. So I really do think that using this auto replenishment tool is a great way to make sure that you're up to date. Then your patrons will dictate whether you purchase it or not, or would like to purchase it or not, based on their usage of that title. So it's in your collection, they have access to it. If they never use it, it stays in your PDA. But this way, at least you know it will have been added. So if you are considering a PDA, we'll walk you through getting this set up. It really is a great way to stay up to date. Another way to stay up to date is a program called the R2 Digital Library Automated Shopping Cart. So periodically, if you're on R2, you probably got one last week because we started Rites of Spring, but Rittenhouse will create shopping carts of titles that you have not purchased or that might need another concurrent user. But we put together this shopping cart based on several parameters. And it's either been requested by your users, it was triggered from your PDA collection, you had an expert reviewer comment that they'd like it. It's a new edition of an existing active title, or it was triggered by a turnaway. So you had too many people trying to access that content at once. We measure that, you have the ability to see that on the platform, but that would also be one of the parameters that we would add it to a shopping cart. We email you and let you know that we have created this auto shopping cart. If you're on R2 and you see these carts out there, they only last for 7 days. So we hope they don't jam up your saved shopping cart area. But if you do see one and you want to save it, you can save it, rename it, and it'll be there forever. The nice thing about these auto carts is that we always extend additional discount with these auto carts. So it's a great opportunity to enhance your collection when we generate them. If at any time you're interested in having a cart generated with any of these parameters, just let your sales rep know, and we can do that behind the scenes for you as well if we're not doing it corporately at that time. So automated carts is another great time saver because, again, you don't have to keep track of all these little things that might have happened with your R2 collection. We do it for you and create that card, and it really just saves you time and saves you money with the discount. Okay, so I'd be remiss if I didn't talk a little bit about access, integration, and discoverability. I'm sure everyone's been hearing a lot about discoverability. Health science libraries are not defined by their physical space, but also by their electronic collections. Many libraries have large collections of digital resources, and just the overwhelming size can be preventative with regards to access and discoverability. So really, I know you as librarians, it's a challenge to facilitate your patrons' ability to search these collections. And we are here to help with discovery. We have a lot of tools that will assist with this, whether it's your R2 collection or your print collection. We are here to help answer that question of discovery. Okay, so first and foremost, if you are on R2 Library, you want to make sure your profile is up to date. So you want to have a screenshot here of the profile, but you want to make sure that your access method is set correctly. I know many of you are using Athens, but you also have local IP ranges. So you want to just make sure that information is populated and that you have enabled username and password for your users so they have 24/7 access if they're outside of your authentication. So if they're not coming in through Athens, that they can still get to the content they need 24/7, especially really important with residents as they, are up for 24 hours a day at times and need access to this information. So when you log in, you just hit your profile, and this is where you can go in and edit and make sure that you are up to date. If you need any assistance with this, Rittenhouse is an expert. Our reps are there to help. So integration, we at Rittenhouse know how important it is that you have integrated your collection so that your usage is high. So you want to make sure that if you've paid for the content, that your patrons are using it. So one of the hallmarks of the R2 Digital Library is the ability to create a deep link to a chapter or a section of content, to an image, and because we're open URL compliant, you can embed them to provide quick access. I know EMR upgrades are in process for most of your institutions. Again, R2 links can be embedded there. If you are creating LibGuides on your website, or even just putting a note out there to your users with a link, we have the ability from R2 to create those links and get them embedded. And we also can create a reserve shelf of reading. So right now, we've curated a COVID-19 collection. That might be something you want to put a link to within the R2 Digital Library, and then put that link out anywhere for your patrons to access. You can email it, you can put it on your web page, but it's a great way to link your content to those patrons when they need it most. So I showed you how to access free MARC, and on the print website, rittenhouse.com, it's really easy to do it from R2 Digital Library. So if you need the MARC for your catalog or your A to Z list, whatever you might need it for, or you just want to export your persistent URLs to embed that link somewhere, all you need to do is log in, go to your under collection management, you can go to my R2 collection, my PDA collection, and then hit the toolbar at the top, and you can see where you can export to Excel or export the MARC. So you have that option anytime in real time to access from the R2 Digital Library. You also have the ability from within any resource to create a link to that content. So I'm in the reading pane, a section on myocardial infarction from the AHA Clinical Cardiac Consult Guide. At the top, again, in the toolbar, you can see there that you have a lot of tools that you can access. The last of which there is to save a course link or a deep link that can be embedded and will direct the user right to this section of content. So again, really important if you have someone or a group of doctors or anyone that is accessing this content and there's a specific book that you want to direct them to, you can do that very quickly and easily with that link. And again, they're going to be authenticated and they'll be able to get right into the content. Reserve shelf. I want to talk about reserve shelf functionality because you have the ability, just like you do in print, within the R2 Digital Library to create a reserve shelf of either eBooks, external links to your journals, articles, sections of books within R2. You can curate and create as many reserve shelves as you'd like right from the platform. So when you are logged in as the admin, you have that option along the left nav. This reserve shelf tab, this is the patron facing side, will only appear after you have created a reserve shelf. So it's really simple and intuitive to create the reserve shelf. But again, you can embed a link to these reserve shelves anywhere. So if you have a nursing preceptor at the hospital that you want to send a link to, you can create a list for them and send that out. Internal medicine department, whatever you might be curating a list for, you can create that link and they'll hit that link and they'll go right to this reserve shelf. They certainly can browse there as well once they're on R2, but again, increasing that access and discoverability with these links is really important. So if you haven't done so, I do encourage you to create a reserve shelf within the R2 Digital Library. It's just a great way to show your patrons that you're working for them. Okay, we have a great way to save in that we have a collection of free eBooks available. So we have OER books on the platform. I know that it's a hot topic within most libraries, giving access to these readily available open educational resources. We have them on R2. So under collection management, it's a special collection called Free. And the MARC manual is a part of that. So if you haven't added them to your collection, we encourage you to do so. If you only want to open an R2 digital library collection with the free eBooks, please do. We waive the maintenance fee if you're only accessing the free eBooks and you have access to all of that content. There's some really good, there's some government publications, but there's also some really good titles from Springer and obviously the MARC manual, etc. So take a look at that. We definitely encourage you to take advantage and have access to this content. Okay, so I'm getting close to my end of my time here, but I do want to mention that we have a lot of outreach tools available that will help you connect with your patrons. So we have a quick start guide. We have the PDF there. We have training materials on how to use the platform. We have links to videos. So if you want to embed a link, how to use the R2 digital library, how to search, how to browse, all of those things are available right from the platform. So along the left nav, just go to the outreach materials and you can access and use them as you would like. They're there for your use. Okay, I promoted at the beginning and I promised that I would talk about deep discount promotions. Rites of Spring is going on now. It runs through the end of May. Many of you who have worked with Rittenhouse for years are familiar with this. You received that 22% discount on one print order and on one ebook order. So I showed you on Rittenhouse.com in the shopping cart, just enter the promo code, do the same for R2. The great news is that if you have a PDA collection, any PDA that triggers and you purchase during Rites of Spring automatically gets the deeper discount. So if you're looking at a collection of PDA titles and you want to quote for that, we certainly can do that. So take advantage of Rites of Spring. I know it's hard right now. If you guys are in the hospitals, most of you, so you are getting books shipped, but if you're not, you can still place your order during Rites of Spring and have them shipped at a later date. So take advantage of the discount while it's available, and especially for the R2 Digital Library. I do want to mention too, I talked about the core collection update service earlier in the presentation. If you have us do a core collection update during Rites of Spring, we will add that discount and honor it. So now is a great time to use the core collection update service. Every month we have a featured list of ebooks we call the best of the best, and they are new books to the R2 Digital Library platform. We offer a deep discount on them, so it's automatically added. All you need to do is check the book out and you receive that discount. We get great selections of titles in every month. We're constantly adding new content, and we really do try to put the best of the best on sale so that you can take advantage of it when it's new to the platform. Okay, so I'm going to launch one more poll, if you'll bear with me. And if you want us to contact you specifically for something, we will do that. Let's see here. Maybe I won't be launching the poll because the polls are closed. So if there's anything that I have talked about today that you are interested in, certainly don't hesitate to email me, whether it's collection management tools, discoverability, outreach support, connecting with influencers, whatever it might be, we can work with you for that. We do have a blog called Rittenhouse Writes where we talk about a lot of these things and we write about them. So if you haven't already, follow us on our blog. And there's my contact information. But as I said, we will be making this available. Grab the handouts. If you hit that handout on the side, I have a list there of all of our services, a little bit more about R2 and PDA. And I guess now I'll open it up for any questions. If anybody has any questions, I'm happy to answer them. You can just type them into your question toolbar. And certainly feel free, if you have something specific, you can email me afterwards if you have something you want to talk about. Any questions? No questions. Okay, well, I really appreciate you giving me the time today. I hope everyone stays safe and healthy out there. And please do take advantage of any or everything I presented. A lot of our services are there for you, developed by librarians, and we really do appreciate working with you, and I thank you for joining us today.
Thank you, Nicole. This is Robin Harvey at FEDLINK. That was a great presentation. Thanks for taking the time to put it together for us.
Oh, no problem. Thank you. I really appreciate the opportunity. Have a great day, everybody.